Hello, Dr. Sushanta Goswami. Thank you for joining us again to discuss various treatment options for high blood pressure. Your discussion last time regarding the general blood pressure was very useful. So, taking the discussion forward, please start. What are the various treatment options for different groups like young adults and diabetics, high blood pressure in the ladies, pregnant ladies. So please start.
Okay. Today, I wanted to discuss. Let me tell a little bit about me. I am a medicine specialist. I did my MBBS from Cuttack Medical College, Odisha, then MD from All India Institute, New Delhi, then came to New York, did my internal medicine residency program, followed by a fellowship in nephrology at the University of Oklahoma Medical Center in Oklahoma, followed by a transplant kidney medicine fellowship at the Houston Methodist Hospital in Houston, Texas, affiliated to Weill Cornell University. Today, we are going to talk about the treatments of high blood pressure. When I tell you about treatment, we don't have to jump into the medication right away. Let's divide our patients to four subgroups. Number one is general population less than 60 years of age. The blood pressure becomes more than 140/90, then we treat it. Another group patients age more than 60 years of age. We only treat blood pressure when their blood pressure become more than 150/90. Other group of patients who don't have any restriction on age group, any age, it doesn't matter if they are less than 60 years of old or more than 60 years of old, but as long as they have diabetes or kidney disease, we have to treat the blood pressure if BP goes more than 140/90. Another group of patients called isolated systolic hypertension. Those are the patients, especially heart disease, people who have heart failure, people who have heart attacks. Their blood pressure treatment is done little earlier than the general population. When the definition of isolated systolic hypertension is if the systolic blood pressure is more than 130 or diastolic blood pressure less than 80, that's when we want to treat if they have heart failure or cardiac disease or heart attack. Then another group of patients called pregnant women. Here, we don't treat blood pressure unless their blood pressure are more than 160/1. Because most of the time, the hormonal changes in the body during pregnancy, mostly estrogen, cause relaxation of the blood vessels and the blood pressure drop. So usually the blood pressure is automatically corrected. But if the blood pressure goes more than 160/110, then we need to treat, because then they land up having complications during childbirth or proteinuria due to high blood pressure. Then it's not good for the baby. So you need to treat unless the blood pressure is more than 160/110. So these are the 4 or 5 categories that we treat differently. Now we need to go to the treatments. Number one for the treatment is lifestyle modification. Number two is stop the medications. There are a lot of other medication over the counter, like cold medications, naproxen, ibuprofen, some pain medications, then some medication, weight loss medications. They cause high blood pressure as a side effect. So we need to make sure that we are not taking any of them. And then if the blood pressure after 3 months still high, then you jump into the medications. Start with one medicine, second medicine, third medicine. I have treated a patient with 4 medications together, even 5 medications for blood pressure in some very resistant cases, like diabetic with dialysis and all those things. But anyway, now we are going to go to lifestyle modification. What are the lifestyle modifications? There are 5C. Number 1C is chloride. That means sodium chloride. If you have taken more than 2.4 gram of salt per day, then usually your blood pressure will be high. So people with high blood pressure, we always tell them to take salt less than 2.4 gram a day in your cooking. Number 2, another C is called calorie. Calorie means your obesity. You're taking a lot of food, junk foods. You are eating meat. You are eating French fries, deep fries, uh, all those things that cause you high cholesterol in your body. Your body weight goes up. You become obese, and the blood pressure goes up. So, how to change your lifestyle? Number one, if you are heavy or eating a lot, number one you have to do is exercise. You need to do 30 minutes of exercise per day. The exercise is good enough to make you sweat. If you don't sweat, you just walk and have fun time and breathe good air and talk all the nonsense with your friends. It doesn't make sense. You need to have a rigorous exercise in order you to sweat it out. As long as you have the sweating with exercise, then you are fine. Number 2 is diet. The diet for for high blood pressure is called DASH diet, DASH. That means dietary approach to stop hypertension, mostly low sodium diet, low cholesterol diet. Number 3 is calm down. You need to calm down. That means stress related high blood pressure. You could be mentally stressed, psychologically stressed, physically stressed, emotionally stressed. You cannot sleep. That's the problem. You need to make stress level low, so be more relaxed. Go some vacations. Don't overwork. That will help your blood pressure to reduce. Because every time we are stressed out, there are stress hormones released in our body. What are the stress hormones? Adrenaline, noradrenaline, steroids. They are secreted in a high amount in our body during stress. And that causes high blood pressure. They cause retention of sodium, retention of water, and blood pressure will go up. So the less stress, good blood pressure control. Number 5 is siesta. Siesta in Spanish called sleep or taking a nap. So at night time, one need to sleep at least 7 hours at night, non-interrupted sleep, good sleep. That will help to reduce the blood pressure. Usually it is seen that in the night time, the blood pressure usually goes down. Then at the morning comes up, then blood pressure becomes little higher than in the afternoon time when you are after work, after school, driving in traffic, stress at work. In the afternoon around 4 o'clock, 5 o'clock, the blood pressure goes highest. That is the diurnal variation of the blood pressure. Afternoon is highest, nighttime is lower. So take a good sleep, 7 hours of uninterrupted sleep, that will help to reduce blood pressure. Then another C is cigarette smoking. You stop cigarette smoking, your blood pressure will improve. Then another C is called cerveza. Cerveza in Spanish is called alcohol. So you stop drinking alcohol in good big amount, then the blood pressure will come down. So those are the lifestyle modifications. And the drugs I told, after that, make sure that you are not taking any other different kinds of medications or drugs that can cause high blood pressure. You need to stop that. Like people who does drug addiction, like heroin, cocaine, marijuana, that cause high blood pressure. So the drug addicts usually come with high blood pressure and stroke. Number two, your some other medication over the counter, like cold medications, like pseudoephedrine, phenylephrine, then oral contraceptive pills for the young girls that cause water retention and hypertension. Then antidepressants, there are different kinds of antidepressants that cause also side effect is high blood pressure. Some cancer medications like um, sunitinib, sorafenib, bevacizumab. These are the blood pressure. Some cancer medication, chemotherapy can cause high blood pressure. Make sure you, if you are taking those medications, you are expected to have high blood pressure. Then you be prepared for taking blood pressure medications. Other medications are steroids, and those are the medications that you need to be aware that we are not taking any of them. Now we go to the medication list. What are the medications we should start if the blood pressure that is not controlled with lifestyle modification, is not controlled with diet, not controlled with exercise after 3 months? Then we have to have medications. What are those medications? I have divided medication into 5 different groups. Number one is 5-star medication. Number two is 4-star medication. Number three is 3-star medications. Number two is 2-star medication. Number four is 2-star medications. Number five is 1-star medications. So let's start with the best medication, which is 5-star. Number one is AC inhibitors called angiotensin converting enzyme inhibitors, or ARB, called angiotensin receptor blocker agents. So let me tell you one thing. The blood pressure, if it's less than 60 years of age, like working class people with blood pressure, you need to, the first choice is AC inhibitor. Like they are called lisinopril, benazepril, fosinopril, quinapril, ramipril, losartan, valsartan, candesartan, olmesartan, telmisartan. All those medications are good, number one choice of medication if you are 60 years of age or less, like working age group. Once you retire, like more than 60 or 70 or 60, say 66 years of age and above, then the number one choice blood pressure is hydrochlorothiazide. Why? Why the difference? Hydrochlorothiazide is good for elderly people because they work, the mechanism of action is cause diuresis. Get your sodium out, your water out of your system, your volume is depleted, and your blood pressure is controlled. But this is not the same for a younger age group who are 60 years or less, because their volume is not constant. They always eat, maybe they'll be eating 5 times a day. They're drinking soda, Coke, water, they exercise, they sweat, they drink, they eat, they're hungry. So their food intake and water intake is not constant. So you can't control them with a little bit of diuretics that that works good for the elderly people, because elderly people, they have very limited eating habit and water intake habit. So they are not eating much. They're taking scheduled food and scheduled water to drink. So you can give diuretics, it will work. But unpredictable people like younger people whose eating habits and water intake are different and erratic. You can't control them with your diuretics. You have to give AC inhibitor as a number one choice. Now, this is number one, 5-star medication. Then 4-star medication is hydrochlorothiazide, I told you. Number 3 is a 3-star medication. That means another subgroup, another medicine that is not that important, but you need to give it as an additional medicine if your blood pressure is not controlled with S inhibitor or hydrochlorothiazide. These are called calcium channel blockers. What are they? They are cardigan, amlodipine, verapamil. Those are the nifedipine. Those are the calcium channel blockers. Also, they are given people who are contraindicated for taking ACE inhibitors like lisinopril or amipril. Then calcium channel blocker works good. Now, another medication, the lower potential medication than that is called beta blocker. Beta blocker is good for heart, but not good as a blood pressure control. We'll discuss about that later on. There are different kinds of beta blocker that only works on the heart, called beta-1 selective antagonist. There are other beta blockers, those work in general. They are good for high blood pressure, also good for migraine, also good for prostate problems. So there are different kinds of beta blockers given in different situations. We'll discuss later. Then another group, the last group, which is not important, is just 1-star medication for blood pressure. They are called alpha blockers. Their names are Cadura, Prazosin, Terazosin. They're good for prostate problems. They control the prostate symptoms and also control the blood pressure. But they are not the first choice for blood pressure for anybody. Then another group of blood pressure called direct arterial vasodilators. Number 1 is hydralazine. Number 2 is diazoxide. Those medications have more side effects. They have headache, pulse rate will go up, you will have a tachycardia, you will have a palpitations, you will have sweating, headache. So those are, and sometimes you gain weight and your water retention happens. So those two groups of medications I told you in the last, called alpha blockers and direct arterial vasodilators, are the last choice of medications. They are just 1-star. If you don't control your blood pressure with other 4 medications, then you add the 5th one. That will be this one. So now we will discuss about each of these medications, what are the indications and what are their contraindications. Let's number 1 start with ACE inhibitors that most commonly we use, like lisinopril, fosinopril, benazepril, ramipril, quinapril, or losartan, valsartan, candesartan, olmesartan, telmisartan. Those are the medications, the number 1 choice. And they are the
So
best
these are
medications.
SE inhibitor and angiotensin receptor blockers.
Yeah, those together, yes. So they are number 1 medications for diabetic, number 1 medication for kidney disease with proteinuria. They will protect the kidney not to lose protein. They're also good for congestive heart failure. But what are the bad side effects? Number 1 is hyperkalemia. They cause potassium to go up. So if somebody's potassium is high, you check it every week, and is potassium high, you reduce the dose or stop, change to something else. Number 2, they cause anemia in long-term use. So a lot of people who have been taking this medication, they have anemia, then we try to reduce the dose or stop that. Number 3 side effect is angineurotic edema and angioedema that causes swelling on the lips, swelling of the mouth, inside the mouth. I will show you picture one time that that happens especially with this kind of medications. It's called angioedema. Lips, tongues, mouth, portion of your inside mouth, they swell up. So you need to stop that. Now, number 2 medicine is hydrochlorothiazide. Now, these are the good medicine for elderly people. But what are the bad thing about it? Because they cause diuresis. They lose sodium. They make sodium to lose through the urine. So you will have a less sodium in your blood. So you have to check weekly sodium level, just like you check weekly potassium level and kidney level in angiotensin converting enzymes. You check for hydrochlorothiazide, you check weekly sodium level in the blood because they lose sodium.
So
If they lose,
are you suggesting the patient go to hospital or clinic every week to check their sodium level, or there
no,
are?
there are, if you are starting initially, you may check weekly. And then once you are stabilized, then you check monthly or 2 monthly. So you can have somebody coming to your house and check the blood, or go to the lab, draw the blood. You don't need to go to clinic. You can just go to the laboratory. There are Quest laboratories. There are other LabCorp laboratories, and there are home service. They come and check blood from you at home. You don't need to see a doctor. You just go, you give the blood, and the doctor will check the results and let you know that you should reduce the medication or increase the medication dose. So for AC
What you
inhibitors,
suggested, sorry, what you suggested is that work in American system where the doctor can get the lab information directly and they have the system to analyze. But in like Indian system, it may take some time to have these things set up.
there are a lot of, in India, we have even more availability of manpower. There are people coming to your house to draw blood. There are like pharmacists, there are lab technicians, they can come to your house and draw blood.
Yes, but
Or you
how
go,
doctor know unless you inform them?
no, no, then you need to talk to the doctor, and the doctor is the one who is supposed to advise you to do this weekly basis when you start a new medication. And the doctor should follow up. If the doctor doesn't call you, you call the doctor. Hey, I give the blood. What is my result? So if the doctor is busy, you need to remind him or his staff to get your result. A nurse can read on behalf of the doctor your results to you, or you can go to the doctor's office, just get the result. Don't have to see him, just get the result. So those things need to work out with with the individual clinic. And some clinics, some doctors are more responsible, some are not. So you need to find out how that system works in each country and each place and each clinic. Here we call the patients. In India, good hospitals, good doctors, they call their patients. But you
Okay,
need to find
good,
out who are
good
good,
to
who are
know.
bad. And the next thing is calcium channel blockers. Okay, so what is the indication of calcium channel blockers? They're best for the stroke. They're best for tachycardia, people whose heart rate is high. They're good for kidney disease. When you can, in kidney disease, at some point you cannot use AC inhibitors or ARBS because their potassium is high, their kidney functions are worse. In that case, you switch to calcium channel. Now, the next thing is centrally acting blood pressure medications. Those blood pressure medicines works in the brain. The brain, they have a system like a dopaminergic system. So the medication which controls dopamine, that medicine called methyl dopa, that medicine is good for pregnant women. So M-Dopa is it was the number one medication until it becomes number second to labetalol, which is mostly given to pregnant women with controlled blood pressure. And then another centrally acting medication is called guanfacine, Guanfacine, guanfacine. These are also centrally acting dopaminergic blood pressure control medications. Now, we'll discuss about the special occasions in next sessions about people who have diabetes, what blood pressure medicine is good. People who have a heart attack, what medicine is good. People who have
Actually, we
yes.
got two questions related to blood pressure control in diabetes. If we can do a little bit on diabetes, if you tell little bit, then I'll have the questions for you.
Okay, let's tell about diabetes. So for diabetes, the best blood pressure medication is ACE inhibitors or ARBS. As I told you, lisinopril, fosinopril, losartan, valsartan, telmisartan, all those things are the best medications. Why? Because diabetes mostly affect the kidneys. And kidneys, once the diabetic sets in, if you don't control well blood pressure, then the kidneys are damaged with high blood pressure and they start losing protein. They start losing vitamins. And the people get depleted of their albumin, which are very important for organ and structure formation in our body. So for those reasons, ACE inhibitors and ARBs are the number one choice for diabetic patients. Now, for heart attack patients and for people who have heart failure patients, congestive heart failure, they have swelling in the body, or they have heart attack, they have stents, they have angina, chest pain. Those things, the best blood pressure is beta blocker. Beta blocker causes control the heart rate. The more the heart rate is controlled, your heart works less. There's less demand for the heart. And then these medications are not only cause the heart rate to come down, but also decrease the blood pressure. So beta blocker is the best medication for heart problems. Now, if somebody has a heart attack, chest pain, or a stent, and diabetic, both together, then what we'll do? For heart attack, beta blocker is the best medication. For diabetics, beta blocker is the least important medicine. We don't give beta blockers to the diabetic patients. Because what happens, when you have a diabetic patients, they're taking insulin, medications, sometimes the blood sugar drops. When the blood sugar drops, it makes your body reacts differently. You become tachycardic, you become sweaty, you know something is going wrong. Then you check your blood sugar is down. Then you take glucose tablets or stop insulin. Then your blood sugar goes up. Then it becomes all right. If you give beta blocker to those patients, their hypoglycemic awareness is abolished. They will not have a tachycardia. They will not have sweating. As a result, your blood sugar might be low. You won't know. You will be dropping dead without any symptoms. So those symptoms of hypoglycemia is abolished by beta blocker. So we don't give beta blockers to diabetic. But somebody has heart attack and diabetic, you have to give beta blocker. So in this situation, there is a selective beta blocker. It's called cardio-selective beta blocker, called beta B1 antagonist. It only works on the heart. So it doesn't matter whether diabetic or kidney disease or stroke, doesn't matter. It will take care of the blood pressure and work on the heart only. It will not affect your diabetic receptors. Those medications are called metoprolol, Lupressor. They're like specialized cardioselective medications, uh, like metoprolol, Lupressor, esmolol, nebivolol, atenolol, bistolic, bisoprolol, butaxolol. Those are specific cardiac medication. You can give these medications, good for heart, control the blood pressure, control the heart rate, will not affect on the diabetic. It's called cardioselective beta blockers. Those things we give when somebody has both diabetic and heart disease.
Okay, so one of the you touched this point earlier, how to change the lifestyle to have a better effect on high blood pressure. So the question here is blood pressure with type 2 diabetes. How a person have to be healthy, will remain healthy after 40 years of age?
After 40 years of age, so what you do, first you control your diabetes, then you control your blood pressure. Lifestyle, the number one treatment for diabetes is lifestyle modification, not the medication, nor the insulin. Same thing, the number one treatment for high blood pressure is lifestyle modification, not the medications. So if you do lifestyle modification, I told you 5C. Number one is chloride. You control your salt intake, less than 2.4 gram a day. Now, sometimes people tell, oh, well, I'm taking less sodium and you told me, but my blood pressure is still high. Then you doubt whether this guy is telling true or lie. Is this guy cheating behind my back at home? Maybe he's taking salt and telling me that I'm not taking salt. Maybe he is trying to not to take salt, but his wife makes a good amount of salty food, delicious food for him. He doesn't know. In that case, what you do, we call the patients and get a urine sample from him in our clinic. And we check the urine sodium. The urine sodium is less than 80. That means the patient is taking low salt diet. If the sodium is more than 100, that means patient is taking high salt. He is not telling you truth, or his wife is giving more salty foods, but is not telling him. Something is going wrong. Is not getting his high blood pressure down because his sodium level is high, more than 100 milliequivalents per deciliter in the urine. That means he is taking more than the salt you advised. That's how we check them.
So we have, is the answer done, or can we take another question, or you still
Yeah.
have question?
Yeah. Tell me.
Okay. So the next question is, a patient is taking hydrochlorothiazide and
Mm-hmm.
chlorthalidone, and
Mm-hmm.
it causes hyponatremia in
Mm-hmm.
some rare cases. What are
Yeah.
the other better BP lowering oral medication options available for these kind of patients?
So then don't take hydrochlorothiazide. Just stop it or reduce the dose to half. The best, you don't take hydrochlorothiazide or chlorothalidone together. You take either of them. Chlorothalidone is best because it is a longer half-life. A lot of time, if you take hydrochlorothiazide, it is good. It may work for 12 to 14 hours, but in night time, the effect is gone. So your nighttime blood pressure will remain high. They have compared hydrochlorothiazide with chlorothalidone. That chlorothalidone, the blood pressure remains low even in the night time. It is a longer half-life. So in those cases where the nighttime blood pressure is high, like at 10 o'clock or 11 o'clock, you're going to bed, you check your blood pressure is still more than 150, then don't take hydrochlorothiazide, take chlorothalidone, 25 milligram a day, or maximum 50 milligram a day. That's it. And then check your sodium level. Make sure your sodium, your salt intake is low. If your salt is, the side effect of the medication is low sodium, then you need to cut down the dose or add hydrochlorothiazide or chlorothalidone to the ACE inhibitor. Now, let me tell you, this is a very interesting thing. ACE inhibitor, say, control blood pressure 30% down. Hydrochlorothiazide controls blood pressure 20% down. If you add hydrochlorothiazide and ACE inhibitor, you think blood pressure will come down to 50% down, right? 30% from ACE inhibitor, 20% for hydrochlorothiazide. So you combine them, it will supposed to get the blood pressure down to 50%. But that's not the case. They work synergistically. The blood pressure in the combined hydrochlorothiazide and ACE inhibitor will come down to 90% down. This is a very important thing to remember. It is a synergistic action. Each of them work less, but if you combine them, the reduction is exponential. So somebody is taking hydrochlorothiazide, is not getting blood pressure well, then add ACE inhibitors or ARB. Then you'll know there is marked reduction of blood pressure. Okay.
Yes, yes. Good, good, good.
So now we almost done. Now I'll tell you another only 5 minutes of thing that, okay, how to control blood pressure.
Excuse me, Dr. Goswami, we have around 2 minutes. So should we continue today or should we discuss the remaining thing next week?
Oh, we can do next week.
Okay. Okay, thank you so much. And we'll be doing the this kind of meeting next week in the same time if you are available, and I will update
Yes.
the link.
Next time we will discuss about how to control the blood pressure in what is blood hypertension urgency, what is a hypertension emergency, and what are the special conditions that you need to get into the hospital and get the blood pressure down by IV medications. Those are some special cases we'll discuss next time.
Okay, thank you so much. I hope it will help a lot of people who wants to know in general about high blood pressure and different diseases. And in future also we'll be discussing with you about different diseases, like especially for diabetes and other things, and about the vitamins and other things. And hopefully in future also we'll discuss special interesting cases that may be very useful tips for the doctors who are preparing for USMLE exam. So thank you for your time, and God bless you. Thank you. Bye.
Thank you.